Hello, my name is Sundus Bassam Ekilan. I'm a clinical nurse specialist and I have finished my master's studies in a critical care program from the University of Jordan. In this presentation, I'd like to present our journey to successful publication from thesis to a published paper. And the title of this working paper is The Lived Experience of Critically Ill Muslim Patients in Isolation. It was under supervision of Professor Rima Safadi from the University of Jordan in cooperation with Professor Valerie Swigert from the University of Pittsburgh. In 2019, I was nominated as a Rising Star student to present this thesis in Sigma Theta Tau 45th Biennial Convention in Washington, D.C. And at the beginning of 2022, this paper was accepted to publish in Scopus Eyesight journal named International Journal of Qualitative Studies on Health and Well-Being. Well, now I'd like to present a brief summary about our paper. Infections and the protective isolation procedures are considered a great burden to healthcare services and the professionals. Critically ill patients have an increased risk of developing infections, either because of having a critical illness, compromised immune systems, or due to acquiring healthcare-associated infections while hospitalized. A review of literature revealed the isolation experience is worsened when combined with a critical illness. A search of the major databases revealed no qualitative studies focusing on the isolation experience of critically ill Arab Muslim patients. Therefore, our study aims to explore critically ill Muslim patients' experiences and perceptions related to their confinement to isolation rooms in Jordan, and addresses gap in knowledge by using phenomenological research, which is used to give voice to Muslim patients who suffer the compound effect of critical illness and isolation. Methods. The descriptive interpretive lens of phenomenology as described by Van Manen was used as a design of this study. This study was conducted in the ICU of a private hospital in Amman, Jordan. The total number of the participants was 10, and they were selected based on a plenty of inclusion and exclusion criteria. All ethical approval issues were considered and obtained during conducting of this research. Semi-structured face-to-face audio recorded interviews were conducted in a quiet and private place at the patient's convenience and within 24 hours of transfer from the isolation room in ICU. Lysis method of data analysis in combination with interpretive analysis supported by Van Manen live world constituents were used in data analysis step. Results. Actually, we have 4 main themes and 10 sub-themes, starting with the first theme, feeling isolated and imprisoned. The majority of the participants in this study express their feeling of being trapped in space and time and suffering emotionally during stayed in isolation room. One of the participants said, "I was scared that I would die alone with no one holding my hands." The second theme is losing basic patient's rights. The most participants of this study reported losing 4 main rights: right to be informed, right to preserve belongings, right to have adequate care, and right to be respected and have dignity. One of the participants stated, "All my personal belongings were taken away from me. My phone, my slipper, my dentures, and even my glasses. I did not know why. The nurses and doctors in isolation rooms assumed that you should be detached from the external world." The third theme is feeling rejected by healthcare providers. The majority of the participants in this study complained about impaired communication with healthcare providers and feeling avoided by them. One of the participants described her concerns by saying, "What upsets me most was that nurses hated coming into my room or talking to me. It was as if this germ was transmitted by air or by talk, who knows?" And finally, the fourth theme is accepting isolation and its adversity. All the participants in this study being considerate of hospital rules and regulations and staff's roles and responsibilities. One of the participants stated, nurses and doctors were definitely scared that they would get the infection. They would think that way, and it's their right to be distant from me. As overall, the participants described the overwhelming impact of isolation on their physical, emotional, social, and spiritual health. In discussion part, we used Van Manen life word constituency framework as an extension of the constructed themes in our findings to illuminate the phenomenon under investigation as designed or as was designed in this figure. We have four main constituents, starting with speciality, refers to the lived space, relationality, referred to the lived relationship with others, temporality, referred to lived time, corporeality refers to lived body. And our findings were arranged under these constituents. And the essence of this phenomenon is surviving isolation. Implications. The findings of this study have universal implications for policymakers, healthcare administrators, and healthcare providers who are providing care directly to critically ill patients in isolation units. It's a crucial point to consider all aspects of care, physical, psychological, social, cultural, and spiritual one. Conclusions. This study provides healthcare providers with an in-depth understanding of critically ill patients' physical, psychological, and spiritual needs. Although the unique needs of Muslim patients are highlighted, it's evident that patient suffering in isolation is universal. Healthcare providers are encouraged to consider creative measures to support and help patients cope with the adversity of isolation experience. And thank you for your listening.